Patients ought to be made aware of the uptick, it seems to me, of pancreatic cancer in non-alcoholic use patients. In fact, in other words, we are seeing too many cancer deaths related to pancreas. And I would advise all to at least have, if you know you've had a family member, no matter what their age was, that died of pancreatic cancer, it's perhaps a very good idea to screen yourself for pancreatic cancer. So at this point, I want to show you some of the images. Here is a liver. You can see normal liver tissue. Even on this slide, I just want to show you the growth, and then I'll show you the microscopic. But you can see this rim here, that's normal liver tissue. And you see this huge mass of metastatic pancreatic cancer in this liver tissue. And then you see there's some residual normal pancreas with pancreatic cancer in it as well. So I'm going to show you those two slides. So we want to begin at this low power view here. This is relatively normal liver tissue. If I go down even closer, you can see there's a little inflammation within the portal triads, but this could possibly be from obstruction, hepatic flow obstruction from pancreatic cancer. But I want to show you this method. So this is relatively normal liver tissue with some portal inflammation, portal triad inflammation. But I'm going to go over here to the cancer now, because that's the highlight. All of this is metastatic pancreatic. You see the nice transition from relatively normal liver to frank metastatic cancer. And if I go to a closer view, you can see what these cancer cells look like that have metastasized to the liver. So this is a nice view of pancreatic cancer that has metastasized to the liver. And you can see the bizarre nuclei and pleomorphism and the whole 9 yards. There's right there. You even see some of the what they call some MOMA bodies. That's that purple calcification material there. That is classic for pancreatic, certain types of pancreatic cancer. You can also see it in certain types of ovarian cancer and lung cancer. But this is obviously associated with the pancreatic cancer, these some MOMA bodies here. Okay, we're going to go to the next slide to show you an image of a transition from normal pancreas to actual pancreatic cancer. So on this next slide, we're going to begin by showing you what normal pancreas will look like. This is very perfectly normal, very histologically preserved, beautiful pancreatic histology, and very normal pancreatic histology. But just over to the other side of this pancreas, you start seeing the pancreatic cancer, probably arising, or more likely, it actually is deriving from the pancreatic duct. And I'm going to go down even closer. So let me go over quickly to show you normal pancreas here, and then go back over to the actual pancreatic cancer. Very malignant, very deadly cancer. And the idea is to detect this cancer early to prevent perhaps death. Oftentimes people who have cancer like this, even like this, that'll get detected early, can survive this pancreatic, very malignant and deadly pancreatic cancer. You can see how a tumor actually infiltrating some normal looking pancreatic material there as well. But you can see it's very deadly, very highly invasive pancreatic cancer. And I'm just going to go over even to a closer view, and then I'm going to finish up by showing just in general, this is how we diagnose cancer. See, when you see ugly cells like that, it doesn't take a rocket science. In fact, a machine can immediately say this is pancreatic cancer without you having to have a human eye put a diagnosis on this. But you can see the nuclear pleomorphism. You can see some glands making an abortive attempt at some malignant cells making abortive attempt at forming glands. You can see some glandular lumina, and in some areas you can actually see some mucinous differentiation and development in this tumor. I don't know if I can show it as clearly here, but some of these glands actually made mucinous material. So this is a very poorly differentiated, highly invasive, and high-grade mucinous pancreatic carcinoma, ductal, arising from the duct, pancreatic duct.